Good afternoon. This is Dr. Bhupesh from Dr. BKM Institutes. Today we have got this small speaking topic, so I'm not going to take more than 1 minute of yours, but still would like to comment the same thing that please listen to this recording 5 times, 10 times. If it is a recording of 1 to 1.5 minutes, it will hardly take your 15 minutes altogether, but this will give you lot of things. The first thing I would like to tell you that don't be dependent upon the examiner. Again, I have told you examiner does not have any marks, so please do not expect anything from him. He is just a patient. तो उसको पेशेंट की तरह ट्रीट करो और अपना बेस्ट रोल प्ले करो. तो ये रोल प्ले एक ऐसा रोल प्ले है where child's forearm is broken and she is having green stick fracture. So you have to explain all the things to the patient. Of course patient will ask lot of things, but sometimes patient will not do anything. So rather than blaming the patient later on, sir mera patient to responsive nahi tha, he was not responsive, I had a massive trouble in explaining role play to him. So please don't do that. आपका paper है, it's your money that you have invested in OET. So आप अपने आप को self dependent बनाओ. So you need to make yourself self dependent. So let me tell you. So good morning, my name is Bhupesh and I am your charge nurse. So how can I help you? See, nurse, I am having my daughter. She fell in the school and now her arm is swollen and I'm really worried. Okay, give me a second. Let me read the case notes. Okay, after reading the case notes, I have come to know that your daughter is having green stick fracture. So that is why she will require a plaster cast and a sling. Oh my God, she's having a fracture. Nurse, I'm really worried. Well, I understand that it is a reason to worry, but at the same time, it is purely treatable. That means your daughter can be well managed with a few things. But before I can explain you everything, I would like to ask you, how did it happen? Nurse, I don't know. She goes to a kindergarten and there she fell, and the teacher told me that she was playing with some toy or something, and she fell over, tripped over, and her arm is swollen. So I went over there, picked up her up, and I brought her to your clinic. Well, that is a nice thing that you have done, that you have brought her to clinic. Of course, she required all these observations, examinations, and after examination, we have come to know that she has suffered from a green stick fracture. Nurse, you are scaring me. You are saying that my daughter is having fracture. Well, yes, but it is a green stick fracture, so there is nothing to worry. It just will require a plaster cast and a sling. So after some time, after like a month and a half, she will feel better. I would like to explain you everything about it. The plaster cast is a cast that sets up on the arm so that the arm does not move much, so that the fracture can be stable. So that means it will help in the healing of the bone by keeping it stable. So it will prevent any kind of vigorous movement, and also it will help to recover the bone in a very quick way. Also, I would like to tell you that future growth will not be impaired at all. That you asked a question that maybe the future growth will be impaired, but I would like to tell you that future growth will not be impaired. Rather, in kids it is normal to have fractures because they play on different things and they do not know that it can be hazardous. So it is quite common to have fracture in kids. So don't worry, the cells will grow themselves and the bone will recover. It will take approximately 6 weeks to heal. That means 1.5 months approximately to recover. Then your daughter can slowly resume her activities from gradual to the vigorous activities. So don't worry, she would be all fine and all the normal activities would be done by her. And right now I would like to tell you one important instruction, that by the time she is wearing the plaster, there are certain activities which she should avoid. She should avoid any kind of vigorous activity that can kind of destabilize the plaster. So please make sure that she does not make any vigorous activity, but she can resume all the normal activities within the limitations of wearing plaster. So these are the things that you need to understand. So have you understood everything? Well, yes, nurse, I have understood everything. Still, I am giving you a leaflet that contains all the information about green stick fractures and the precautions that you need to take. If you follow all these instructions given in the leaflet, your daughter will be fine. Apart from this, if you have any question, please do not worry and feel free to contact us anytime. Even if when you go back home, after that, if you have any question, you can ring on our clinic number and we will respond you accordingly. So is it all good? Have you got, is there anything that you would like to ask? Well, no, nurse, that's all good. Okay, take care. Thanks. And if you need anything, do let us know. All right, take care. So this is how you complete your role play. So I'm just going to unmute you and ask you if you have any questions whatsoever. किसी को भी कोई क्वेश्चन पूछना है तो पूछ सकते हैं. मैंने आपको अनम्यूट कर दिया, प्लीज. Any questions, please? By anyone?
No, sir.
No, sir.
Understood, sir.
Chaliye. So I'm stopping the recording. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.